You have some missing teeth, and I doubt if you're very happy about it. There are several ways to replace these missing teeth. Some of the replacements are fixed into your mouth, cemented in, you can't remove them, while others are removable for cleaning and for repair. This video emphasizes the removable replacements, discusses the alternatives for your tooth replacements, the advantages and disadvantages of each, the relative costs of the alternative treatments, and what happens if you don't do anything. A removable partial denture is a custom-made replacement for your missing teeth, usually constructed with a framework of strong metal, covered with a gum-colored plastic with lifelike teeth placed in areas of the missing teeth. The partial denture seats securely into your mouth, and it can be removed at will for cleaning and repair. Most patients remove their partial dentures several times per day in privacy to clean the remaining teeth and the partial denture itself. How is a partial denture made? An impression is made of your affected jaw and the remaining teeth. Models are made of both jaws, and the new bite and appearance are determined by the dentist. Usually, but not always, a metal framework is made to support the plastic gums in the teeth. Sometimes a partial denture can be all plastic. The new removable partial denture provides chewing efficiency, and you can easily see the change in this patient's overall appearance. Partial dentures have the following advantages. They're the least expensive treatment alternative for replacement of your missing teeth when you have some other teeth remaining. They can be removed for cleaning and repair. They can build out missing gums and bone contour well and still allow you to clean underneath them by removing the partial denture. And they can be quite pleasing aesthetically. The disadvantages of partial dentures should be pretty clear to you. They must be removed from the mouth frequently to clean them, during which time you can drop them or break them. Generally, they're not as stable as fixed replacements, nor do they provide the same feeling of natural teeth as some other more expensive alternatives. Obviously, they come in and out. Let's observe the other fixed treatment alternatives for missing teeth with some natural teeth still remaining. If you have enough natural teeth remaining, fixed bridges connected to and supported by natural teeth are an excellent alternative. Most people feel like they're just natural teeth when they're completed. You're observing a missing tooth on the patient's upper left side. The teeth planned to support the fixed partial denture have been trimmed down to provide enough space to allow them to receive crowns or caps and still look like natural teeth. A dental laboratory has made a ceramic bridge to be cemented into the patient's mouth. Fixed bridges may be ceramic, metal, plastic, or a combination of these materials. This example of a fixed bridge replacing only one missing tooth shows the pleasant appearance of these restorations. And this patient has multiple units of fixed bridges. They feel, chew, and look just like natural teeth, but they cost significantly more than removable partial dentures. If enough bone is present to support implants, these now well-proven metallic replacements for teeth are anchored into your jaw bones and support fixed bridges or crowns very well. There are very few risks for removable partial dentures. However, when considering implants, there are the minor risks always associated with minor surgery. And the cost of implants is many times more than the cost of removable partial dentures. However, implants and fixed replacement teeth provide chewing and aesthetic appearance nearly identical to natural teeth. The patient you're observing has had the missing tooth replaced by having one implant placed into his lower jawbone and a crown placed over the implant. Now, this patient has had two implants placed in the front part of her upper jaw with a fixed bridge placed over them, supported only by the implants. The slight metal you see is not observable as she smiles. The remainder of her broken down teeth have received rebuilding techniques before crowns were placed on them. As you might expect, such treatment is quite expensive, but these restorations are as close to natural teeth as anything dentistry has to offer. In recent years, placement of metallic implants into jaws has become a routine and trusted treatment. If you do not have enough natural teeth to support fixed bridges, implants can be placed in areas where teeth have been extracted and used to assist in supporting crowns or fixed bridges. This highly accepted treatment is excellent, but it is many times more expensive than removable partial dentures. This patient had no teeth in the lower right area of his jaw. 2 implants and a properly engineered fixed bridge have allowed him to chew and appear in a normal manner. Many patients feel that extraction of all their teeth is going to solve all their dental problems. And, well, extraction is the least expensive treatment. Although upper denture wearers have reasonable success and satisfaction with their artificial dentures, it's well known that most lower denture wearers do not like their lower dentures. It's as high as 90%. Please observe these simulated lower human jaws. The jawbone on the left represents the size of the jaw soon after teeth were extracted. But look at the jaw on the right. The shrinkage of bone over just a few years is not avoidable, resulting in lack of support and retention for a removable partial denture. Most dentists strongly support keeping your natural teeth just as long as possible, regardless of how few you have, to provide optimum chewing function and optimum aesthetics. You can always remove the natural teeth. You can't put them back unless you're going to use some of the replacements we've talked about. Use your natural teeth as long as possible. Many patients retain their natural teeth for their entire life. Usually removable partial dentures are a better alternative than removal of the teeth and placement of complete dentures. Removable partial dentures are the least expensive alternative for several missing teeth, and most third-party insurance companies will pay a significant portion of the cost for removable partial dentures, where they won't pay for the cost of a lot of the alternatives. Crowns or bridges placed over natural teeth are several times more expensive than partial dentures removable. Crowns or bridges over implants are equal to or more expensive than when natural teeth are present to support the fixed bridges. Removal of all your teeth is usually less expensive initially than the fixed alternatives. However, continued relining and remaking of the artificial complete dentures over many years as the bone shrinks and the denture wears out is a very significant expense. Well, you have some missing teeth. You may elect not to replace them, but you'll still continue to have the functional and aesthetic impairments that you now currently have. And yes, removable partial dentures are an inexpensive, relatively functional, and potentially highly aesthetic replacement for your missing teeth when some serviceable teeth are still remaining. The clinical procedure is simple, fast, and effective. However, several other more expensive alternatives that can be fixed into your mouth may serve you better if you can afford them. I'd strongly suggest you talk to your dentist about the alternatives he or she can offer you for your specific situation.